Welcome back to the show. As we saw in the first episode, the superheroes from the National Statistical Office support their colleagues in government with data to understand what's happening across the country. Once again, there's trouble in Stygia. Can the superheroes help?
I'm delighted to announce that the Ministry of Health will be working closely with the National Statistical Office over the next few months to study how the National Health Service diagnoses and treats diabetes.
Minister, what prompted you to start this study now?
As you know, the Ministry of Health, like the other line ministries, has an ongoing collaboration with the National Statistical Office. We rely on quality data to deliver a good service to the people of Stygia and to spend taxpayer dollars wisely.
Why diabetes? Why not another disease like cancer or tuberculosis or HIV?
All in good time. Those conditions are also important, and we continue to monitor them closely. We're studying diabetes because the ministry's administrative data suggests that recently there's been an increase in the prevalence of diabetes. Perhaps this increase is related to the population of Stygia getting older and an increased prevalence of chronic conditions. We want to understand why.
How are you going to do that?
Frida, that's a question for you.
The National Statistical Office is collaborating with the Ministry of Health. We will put our heads together, compare data and methods, and try to understand what might be causing this apparent rise in cases.
Diabetes care costs nearly 1.5% of Stygia's gross national product. This is big business. I'm afraid that's all we have time for. Thank you.
Yes, I did see them. I'll take care of it.
Sorry I'm a bit late. How's it going?
Very well, Minister. We've compared our ministry's administrative data with other data sources that the National Statistical Office manages. And together, we've reanalyzed the data using standard methods, the methods used for official statistics.
In Eastern Province, the rates of cardiovascular disease, cancer, arthritis, hypertension, and dementia are higher than in the other provinces.
The population in Eastern Province is older. People move there when they retire. The weather's nice and housing is inexpensive.
So it's not surprising that those chronic diseases are more prevalent in the older population.
But look at this graph. The prevalence of diabetes, and also shingles and epilepsy, appears to be a lot higher in Eastern Province, according to our administrative data.
Way out of proportion to the other diseases associated with aging.
That's strange. What's going on?
Minister, is there any chance that someone might have something to gain from reporting a few extra diabetes cases? Or perhaps something to gain from the treatments for diabetes or shingles or epilepsy?
There is a drug, pregabalin, or Lyrica is the trade name. We prescribe it to treat nerve damage from diabetes and also for shingles and epilepsy. There are some reports of recreational use. Like many pain medications, it is a controlled substance.
Not available over the counter, eh? You need a prescription to get it?
Do you have data on prescriptions?
Of course.
Let's have a look.
Can you believe the Ministry of Health already has version 5 of the STAT software? The graphs it creates from data are amazing.
The NSO budget for next year includes funding for some software upgrades. Until then, we'll have to be patient with version 4.
Good afternoon.
Hi.
I understand that you're looking into diabetes treatments in Eastern Province.
We're with the National Statistics Office, and we're collaborating with the Ministry of Health. That's public knowledge.
Good, very good. You're collaborating. I'm quite sure you'll find that the ministry's data is just fine as it is. No irregularities. Nothing needs to change.
We've just started the collaboration. I'm sorry, I didn't catch your name.
Flex Luther. Perhaps you'd like to collaborate with me. I can make it worth your while. I believe you are fond of statistical software, and I have version 8.
How'd you get that? The Ministry of Health has version 5 and we've only got version 4. They already made a version 8? How's that possible? What happened to 6 and 7?
Sometimes they skip ahead.
Look, I don't know who you are or where you got that bogus software, but you can't bribe us. We're from the National Statistics Office. We're unbiased and independent.
Why do you use that nasty word, bribe? I want to collaborate.
Forget it, Flex.
Welcome, everyone, and thank you for coming. I would like to thank the Ministry of Health's data team and our colleagues at the National Statistical Office. Their close collaboration over the past few months has helped us to uncover an important but isolated instance of attempted fraud. Attempted fraud by a few health workers in Eastern Province. I am disappointed that this has happened, but am determined that we will root out the perpetrators and bring them to justice.
How long has this been going on? What's the nature of the fraud?
For about a year, health workers in the Eastern Province have been fraudulently prescribing and dispensing a pain relief drug, then selling it on the black market.
Did they take pain relief medication away from people who needed it?
No. Thankfully, the perpetrators did not interrupt patient care. Those patients who legitimately needed the drug received it. The perpetrators ordered more of the drug than Eastern Province actually needed, then sold it.
How'd you find out?
Our administrative data focuses on numerators. We know how many people come into our clinics and how many people request services. What we don't know so well are denominators, how many people need our services. That's where the National Statistical Office came in.
We reviewed the Ministry of Health's administrative data nationally. We were able to identify some anomalies in the Eastern Province and then followed up to investigate.
We'd like to thank our colleagues in the Eastern region who have cooperated fully with this inquiry.
How much taxpayer money was lost?
Very little, actually. The fraudsters chose a drug that's not very popular on the street, so they built up a big inventory but weren't able to move it. Once they realized their mistake, we think they tried to move their operations into fraudulent software. We've taken possession of the surplus medication and will dispense it through our regular pharmaceutical supply chain.
Crime doesn't pay, right, Minister?
Right.
Curses! Foiled again! Just you wait, National Statistical Office. Just you wait.